Hi, I'm Dr. Muralidhar Kathalagiri. I'm a consultant, robotic, laparoscopic, bariatric and gastrointestinal surgeon. A soft bulge that is seen in the groin region or the umbilical region can actually be an umbilical hernia. And these swellings appear when you strain or stand or do some rigorous activity, and it can actually disappear when you lie down. Sometimes this swelling may not disappear and stay there, but may not cause any symptoms, or sometimes may cause some pain and discomfort as well. So yes, if you see a soft bulge in your groin region or umbilical region, it can be a hernia. The muscle strains are generally painful and it appears after a sudden rigorous physical activity. There may not be a bulge or a swelling. Whereas hernia, quite likely that you may actually see a small bulge or a swelling. And also sometimes in early hernias or initial stages, there may just be pain and may not be having a swelling. So in either case, we have to evaluate and check and see whether there is a hernia swelling. If it is there, we do some certain physical examination, and sometimes we also do scans to confirm whether it is a strain or it is a hernia. The hernias will not disappear on its own. Once it happens, it stays. With time, it may actually increase as well. And sometimes it may cause certain complications like pain, intestines getting stuck and causing incarceration or irreducibility, that is the swelling is not reducing. And sometimes and rarely it can cause the bowel getting stuck there and may cause obstruction or gangrene. These kind of complications may happen in cases of hernias. No, so hernia does not go on its own. The hernias can cause sometimes discomfort or pain during intimacy. It all depends on the defect size and the contents that is coming inside. Because intimacy is a form of strainful work or exercise, it can cause discomfort.